I walked into the room and washed my hands. I'm gonna write a few things down. Okay, my name is Olivia Colbert. I am a physician assistant with Advent Health University. Can you confirm your name and date of birth?
Faith Silverman, 11/21/01.
And how would you like to be addressed today?
Faith is fine.
Okay, Faith, can you tell me where we are?
Advent Health University,
And do you know today's date?
July 13th.
Great. Faith is here today for her annual physical exam. She's alert and oriented. He is alert and oriented to person, place, and time. He is self-referred and reliable in providing history today. Do you have any adult chronic or acute illnesses?
No.
Any childhood acute or chronic illnesses?
No.
Do you take any prescription medications, over-the-counter medications, or any supplements?
No.
Do you have any medication allergies, drug sensitivities, or environmental allergies?
No.
Have you ever had surgery?
No.
For a few male-specific questions, are you sexually active?
Yes.
What is your sexual orientation?
Heterosexual.
Do you use condoms?
Yes.
Any history of sexually transmitted infections?
No.
Any prostate, sexual, or urinary issues?
No.
Okay. Do you have any psychiatric history?
No.
Any hospitalizations?
No.
Are you up to date on your childhood immunizations?
Yes.
Okay. For your adult immunizations, have you been vaccinated for tetanus?
Yes.
When was that?
It was last year.
Okay. What about for the flu?
Also last year.
Okay. And then COVID.
2021.
And do you know which company?
It was Pfizer.
Great. So for screening, have you ever had screening for tuberculosis or a colonoscopy?
No.
Okay. Do you know any family history?
No, I'm adopted.
Okay. And then for social history, what is your relationship status?
Single.
Okay. You're single. Do you have any children?
No.
What is your sexual orientation?
Heterosexual.
Okay. Do you go to school or do you work?
I go to school.
Okay. What is your current living situation?
I live in a house.
Okay. Do you feel safe in that house?
Yes.
Do you use any safety precautions like wearing a seatbelt, wearing a helmet, or wearing sunscreen?
All the above.
Okay. Do you exercise?
Yes.
Do you, how often do you exercise?
Twice a week.
Okay. And do you have a healthy diet? What's your diet like?
Yes, my diet's healthy.
Okay, good. And what about caffeine? Do you drink?
2 cups of coffee a day.
Okay. Do you smoke? Do you do drugs? Or do you smoke or do you do drugs?
No.
Okay. And then lastly, here at Advent Health University, we do like to incorporate spirituality into our exams and with our patients. So are you going to need or do you request any sort of spiritual assistance at the time?
No.
Okay. Do you drink alcohol?
No.
Okay. So now I'm going to move on to the review of systems. I'm just going to ask you a few questions about anything that you're currently dealing with or that you have in the past. If they're applicable to you, just let me know.
Okay.
Okay, so I'm going to start with general. Are you your usual weight at the moment, or have you had any recent weight changes?
Usual weight.
Okay. How are your clothes fitting?
Normal.
Okay, good. Are you experiencing any fever or fatigue?
No.
Any changes in your sleep or insomnia?
No.
Okay. For the skin section, Any sort of lesions, sores, lumps, or rashes?
No.
Okay. Any itchiness or dryness of the skin?
No.
Any recent color changes to the skin?
No.
Any changes in your hair or your nails?
No.
And then what about any changes to the color or size of your moles?
No.
Great. I'm going to move on to the head. Any headaches, dizziness, or lightheadedness?
No.
Any recent head injuries?
No.
Okay. Okay, I'm going to move on to the eyes. Have you had any recent changes in your vision?
No.
Do you wear contacts or glasses?
No.
What about your recent eye exam?
I had it 6 months ago and it was good.
Very good. Are you experiencing any pain or redness?
No.
Any sort of excessive tearing?
No.
Any double vision, spots, specks, flashing lights, anything like that?
No.
Any glaucoma or cataracts?
No.
Very good. For your ears, have you had any recent changes in your hearing?
No.
Okay. Any ringing in the ears or vertigo?
No.
Any ear aches, ear infections, discharge, ear pain, anything like that?
No.
And do you wear hearing aids?
No.
Okay. I'm going to move on to the nose. So do you experience frequent colds?
No.
Okay, are you having any sort of stuffiness or nasal discharge?
No.
Any itchiness?
No.
Hay fever ever?
No.
Okay, any bleeding of the nose?
No.
Any general sinus troubles?
No.
Okay. I'm going to move on to the mouth and the throat. So regarding that, how are the condition of your teeth and your gums?
Good.
Good. Any bleeding of the gums?
No.
When was your last dental exam and how did that go?
It was 3 months ago and it was good.
Very good. Do you wear dentures?
No.
Okay, what about your tongue? Any sore tongue?
No.
Any dry mouth?
No.
Any hoarseness?
No.
Sore throats?
No.
Nothing like that? Okay, good. Now I'm going to move on to the neck. Are you experiencing any swelling of your glands or goiters?
No.
Any stiffness or pain in the neck?
No.
Okay. Okay, moving on to the breasts. So for your breasts, are you experiencing any lumps or pain?
No.
Any nipple discharge?
No.
And how often do you perform self-examinations?
Once a month.
Good. Okay, so on to respiratory. Are you experiencing any cough?
No.
Any sputum coming up?
No.
Any hemoptysis?
Mm-mm.
Any wheezing?
No.
Okay. Any dyspnea?
No.
So I'm going to list off a few disorders and diseases. Just let me know if you've ever been diagnosed with them. So asthma, bronchitis, emphysema, pleurisy, pneumonia, or tuberculosis.
No.
And have you ever had a chest x-ray?
No.
Okay. So I'm going to move on to cardio. So have you ever been diagnosed with heart failure?
No.
High blood pressure?
No.
Rheumatic fever?
No.
Any heart murmurs or palpitations?
No.
Okay. Any past EKGs?
No.
No other heart tests?
No.
Any orthopnea?
Nope.
Dyspnea on exertion?
Nope.
Any sort of paroxysmal nocturnal dyspnea?
No.
Okay. Any edema?
No.
Okay. Okay, now I'm going to move on to GI. For GI, have you experienced any sort of trouble swallowing?
No.
Any heartburn?
No.
Any sort of nausea, vomiting, regurgitation,
Nope.
indigestion,
Nope.
chest pain or discomfort?
Nope.
Okay. So for that, regarding your bowel movements, how frequently are you having bowel movements?
Once a day.
And what's the color and size of those?
Brown and sausage shaped.
Okay, good. Have you had any recent changes to your bowel movements?
No.
Okay. Let's see. So regarding your bowel movements, any sort of pain with defecation or
No.
rectal bleeding?
No.
Any sort of abdominal pain?
No.
Any food intolerances? Any
No.
jaundice, hepatitis, gallbladder or liver problems?
Nope.
Any hemorrhoids?
No.
Okay. Black tarry stools, I don't know if I said that already, I'm sorry. None of that, okay. So for GU, regarding your urination, how frequently are you urinating?
Like 6 times a day.
Okay. Any polyuria, dysuria, hematuria, or nocturia?
No.
Any urgency?
No.
Any retention?
No.
Any incontinence?
No.
Any sort of kidney or flank pain?
No.
Any urinary infections?
No.
Any suprapubic pain?
No.
Okay. Renal colic?
No.
Okay. What is the flow of your stream like? Is it normal?
Yeah.
Okay. So regarding a few male-related questions, have you experienced any hernias?
No.
Any sort of draining or fluid coming from any skin lesions or?
No.
No, okay. Are you sexually active?
Yes.
What is your preference?
Female.
And your orientation?
Heterosexual.
Are you satisfied sexually?
Yes.
Are you experiencing any sort of dysfunction?
No.
Have you ever noticed any sort of masses or lumps in your testicles?
No.
Okay. So for peripheral vascular, have you experienced any sort of intermittent claudication?
No.
Any sort of cramping?
No.
Varicose veins?
No.
Clotting in your veins?
No.
Any sort of swelling with redness or tenderness?
No.
Any sort of swelling in your hands, your legs, your calves, or your feet?
No.
Have you ever been diagnosed with Raynaud's syndrome?
No.
Okay. Okay, so for musculoskeletal, are you experiencing any sort of joint or muscle pain?
No.
Any gout?
No.
Backaches?
No.
Stiffness or
No.
pain anywhere?
No.
Okay, great. Any arthritis?
No.
Okay. So to move on to neuro, I'm going to ask about any recent changes to mood,
No.
attention span, or speech?
Nope.
Any changes to your orientation, memory, insight, or judgment?
No.
Okay. Have you ever experienced seizures?
No.
Any sort of muscle weakness?
No.
Any tremors or involuntary movements?
No.
Any fainting or blacking out?
No.
Any headaches or dizziness?
No.
Okay. Any fainting?
No.
Okay. Seizures?
No.
Okay. I'm gonna move on to psych now. Any sort of anxiety or nervousness?
Nope.
Any tension?
No.
Going back to GI for just a moment, have you had any changes in your appetite?
No.
Okay, I apologize. Back to psych. Have you ever had any sort of psychiatric admissions?
No.
Any psychotherapy?
No.
Any kind of counseling in the past?
No.
Any suicidal ideations or attempts?
No.
Okay. Any mood changes or memory changes?
No.
Okay. And then for hematologic, any anemia diagnoses in the past?
No.
Okay. Do you experience easy bruising or easy bleeding?
No.
Okay. And then last for that, have you ever had a blood transfusion?
No.
Okay. So for the last category, for endocrine, are you experiencing any sort of thyroid trouble?
No.
Okay. Any changes in how your gloves, hat, or shoes fit?
No.
Any polyuria?
No.
Any swelling in general?
No.
Okay. Any excessive sweating?
No.
Any excessive hunger or thirst?
No.
Any kind of heat or cold intolerance?
No.
Any diabetes?
No.
I'm done.